How do you identify and protect the recurrent laryngeal nerve, the nerve to your voice box, during a parathyroid surgery? I'm Dr. Babak Larian from Center for Advanced Parathyroid Surgery. It's a very important question. The most important thing the surgeon needs to do is to actually be very familiar with the anatomy. So when you look at the neck and you see this is the thyroid gland, right? And these are the vocal cord nerves that go behind the thyroid gland. So let's magnify this. Again, the thyroid, you can see the outline of the thyroid gland here. This is the breathing tube, which goes behind the thyroid gland. And these are the vocal cord nerves. Now, the lower parathyroid or the inferior parathyroid is usually superficial to the nerve. So you can see it. Superficial to that nerve. While the upper parathyroid is deep to that nerve. Same thing holds up here. This side partially deep, and although away from the nerve, it is in a layer that's superficial to that nerve. So you may be just right over the nerve itself, or maybe to the side, but somewhat more superficial. This anatomical distinction is really important, right? It's really, really important to know this when you're doing parathyroid surgery. So I'm going to show you an example of parathyroid surgery, which I had pictures taken of it during the surgery endoscopically. So this is a minimally invasive parathyroidectomy. You can see the incision marked in the lower neck. This is the marking of the anatomy of the voice box. This is the Adam's apple up here. And this is another cartilage called the cricoid. These landmarks give me important information because the voice box nerve comes and goes right there into the voice box like that. Okay? So this is endoscopic view inside the wound, and this whole thing is the thyroid gland. And deep to the thyroid, again, thyroid here, we see the tip of the parathyroid right there, top of it. And then as we dissect gently and go deeper, we see more of that parathyroid gland. Again, the thyroid is visually obvious, and you can see the blood vessels on the thyroid itself. And you can keep everything clear. You can see the field is very dry. And now the parathyroid is dissected more. And now we can see the vocal cord nerve. All right, so at this point, I dissected the vocal cord nerve so I can clearly see it. When I can see the nerve, then I can be gentle around it and I can protect it from anything happening to it. So you have to keep that nerve in view, especially when you're doing the superior parathyroid. This is the left upper parathyroid gland that's enlarged and turned into an adenoma, and this whole thing is an adenoma. And now you see it even more clearly. So dissect it from underneath the nerve. Okay? And you can see this parathyroid being grasped by this instrument and pushed away from the area of the nerve. So again, gently doing the surgery so that you can protect the nerve. And now the parathyroid is released except at its blood vessels that are coming to feed it, right? And the nerve, I still see the nerve here behind the parathyroid now, because now I've brought the parathyroid, the superior parathyroid that used to be deep to the nerve, now I've brought it forward. I've exposed the blood vessels feeding it, right? And I'm not gonna cauterize the blood vessels. So these are the blood vessels that were cauterized. You can see that they're charred and separated. The nerve is again in view and fully intact. And now the parathyroid is separated from the blood vessels. These are the blood vessels, the nerve, and the parathyroid is completely separated from it and removed. And the nerve is fully intact, not even bruised or swollen. You can see that the nerve is fully intact. So knowing the anatomy allows you to really see the nerve well and do the right thing and protect the nerve and make sure the nerve is okay the whole time you're doing the surgery. That is a priority, to make sure you're keeping the nerve healthy and safe and clear. And this is the parathyroid once it's out, and this is the incision closed. This is before and after, just a little piece of tape on an incision. Now let's look at a inferior parathyroid, okay? So again, you can see the thyroid gland that's being reflected and the parathyroid. The parathyroid is now dissected even more and separated. You can see the blood vessels coming into it here. And then again, further dissected, and then the blood vessel is very obvious now. This whole thing is a parathyroid. And in order to do a safe removal, I'm going to try to find the nerve. And this is the nerve that's underneath this parathyroid. Okay? And the blood vessels are here. So I have to gently lift the parathyroid, disconnect the blood vessels that were over it, and make sure that the nerve stays intact and safe. And this nerve is fully intact. The parathyroid has been removed. It was a pretty large parathyroid, with the size of the incision almost. And incision closed, and that's the parathyroid out. So almost an inch. So a large one. But you can see that the nerve can be clearly visualized. Protecting the nerve requires that you identify the nerve, right? Now, sometimes when the parathyroid is so superficial, to be so superficial to the layer where the nerve is, so if the nerve is this deep and the parathyroid is all the way up here, and the top of the screen, let's say, is your skin, right? I don't need to, in this scenario, go all the way down and try to find the nerve because I know the parathyroid is away from it. I can remove it safely, okay? But as the parathyroid is deeper in, I really have to find the nerve and protect it from any kind of injury or trauma. That will make sure that the nerve functions properly and is not even bruised or swollen. Okay, so it's well worth taking extra time. I know there's a lot of people who want to do the surgery fast and quick and pride themselves in doing a fast surgery. I think doing a successful surgery without complications is really the key in doing a parathyroidectomy well. If you're interested in clear parathyroid information, visit us at parathyroid.net. Be well.